Research shows that patients and healthcare professionals spend very little time discussing a patient's obesity. Many obese patients believe that they are slightly overweight, not obese, and are either quite surprised to find that they are obese, or they are never told that they have a severe medical condition. Patients do not always realize the extent to which their excess weight contributes to obesity-related health diseases. It's our responsibility as caring physicians to appropriately screen patients for obesity, speak to them of the health risks associated with this disease, and start a conversation in which patients can begin to determine the best course of action for themselves to return to a healthier state, because we now know it's possible. Starting a conversation with patients about their excess weight, how it is affecting their health, and their treatment options is important.
A lot of physicians are not comfortable even talking about obesity to their patients. So we've done research showing that in an encounter with an obese patient, the topic of obesity is going to come up in less than 10% of interactions, right? Which in most cases, the patient will be there, everybody knows that there's a problem, the patient won't bring it up, the doctor won't bring it up, the patient leaves the appointment, nothing happens. And that is really because the comfort level of talking, how do I even start a conversation about someone's weight without offending that person? That's a skill, it's a professional skill. Now it's not that doctors can't do this, because if you're a trained health professional, you're having conversations about sensitive topics with your patients all the time. You're asking them about sexual preferences, you're talking to them about recreational drug use, you're talking about suicidal ideation, you're asking them about all kinds of intimate questions, and you do that every day and all the time. And so I think you're up against all of those barriers that physicians don't have a good understanding of obesity as a chronic progressive disease. They don't really understand the physiology. They don't really feel comfortable having a conversation about weight. And I think we have a huge job to do here in educating not just the physicians and colleagues and the nurses, the dietitians, the psychologists, everybody who's there in healthcare, but we also have a huge job to doing here in educating the general public and understanding that what you're up against is a chronic progressive condition that is really going to ultimately drive your entire health. And it's not just health, it's your quality of life, it's your ability to work, it's everything.
The first step is for healthcare professionals to be aware that a conversation should occur. If they don't have time for it in a current appointment, they should schedule a specific appointment to discuss the health issues associated with obesity and the treatment options available. Many healthcare plans, including Medicare and Medicaid, offer reimbursement for obesity counseling, highlighting the importance of facilitating these conversations.